of Parálisis Cerebral Respuestas. This week, I am very excited because I'm not recording at home. Yay! I'm recording from a friend's office, which is a dream come true because when I talked to her in October, yeah, it was in October. I was like, yeah, I'm going to go visit you and we're going to hang out and this and this and that. I didn't think it was going to be this soon, to be honest.
We did it.
So we did it, and I'm so happy because recently I had the honor and privilege to moderate one panel that I'm extremely excited to talk about, and I'll talk about it in this episode. And in case you don't recognize her name, would you like to introduce yourself,
Yes.
my friend?
I would love to, friend. My name is Bhooma Aravamutha. I am a child neurologist and associate professor of neurology and pediatrics at Washington St. Louis, and I specialize in caring for children with CP and conducting research to help cure dystonia in kids with CP. Yay!
She is amazing. Yes. And this time around, we're joined by another amazing guest, and I'll have her also introduce herself. And I met her yesterday, but when I saw her, I was like, oh my God, I feel like I've known you for a very long time.
Oh.
So, my dear, introduce yourself.
I'm Emma Lott. I am a research assistant in Bhooma's lab.
Yeah.
I help organize CP Family Day, and I do a lot of other qualitative analysis stuff in Bhooma's lab. So.
That is amazing. Amazing women changing the world. And I'm honored to be among you. Thank you so much for everything you do. And speaking of what I mentioned earlier, well, just now, CP Family Day, for me, there's only one adult center that I know of that has CP Family Day, which is the Weinberg CP Center in New York. But even then, which we love them, I love them. I send them a huge hug. This is the first time that I'm in a place where there's a panel for adults. But before I go into that, for listeners who did not have the opportunity to attend here in this event here in St. Louis, which I must say it's in Missouri, who actually did not attend or have never attended, because this is the 4th annual, how would you describe CP Family Day, and how did you first come up with the idea?
Yeah, I can talk about it. So CP Family Day is an event at the Missouri Botanical Garden here in St. Louis. It's a free event for all of our families at the CP Center at St. Louis Children's. It's about a 3 to 4 hour long event. It features dual programming, so while we have caregivers attending resource sessions, learning about various community providers in the area, at the same time there are children with CP and their siblings, and some of our volunteers and their children are out in the garden going through various adaptable activities out there. Yeah, and then I guess in terms of how it was created,
I can take that part, how it started. So there's a family that donated to our CP Center who had a child who was cared for in our CP Center who then became an adult with CP and passed away. And they're really spoke beautifully about his life and how they wish they had known more about what it was like to grow up with CP and about living a long, full life as a person with CP. So CP Family Day is centered around building community and teaching families of children with CP about what's available in the community and about each other, but also about giving them the chance to talk with adults with CP, caregivers of adults with CP, and really understand the resources that can support them and their child as their child grows up and becomes an adult with CP, and hopefully give them the opportunity to think about what it's like when their kid grows up, which is something that we are really focused on talking about much more now. And for some families, CP Family Day is the first time they really get to explore that possibility of hope for a full life for their child beyond pediatric care.
Wow, that's, oh my God, we just started and I'm going to cry.
No!
God damn it. No, we have Kleenex though.
We do.
Always have Kleenex.
Yes.
Wrote that for next year as a note.
Yes. In the panel, I got very emotional and there was no Kleenex and I was like, oh my God. But at some point, someone came in and brought some. But so it all started with a donation from a family. Obviously, we're not going to name names, but I will say thank you to that family for doing that, because they not only honored their son, but they honor also all of us that live with CP. So thank you to that family and to the memory of that adult. That is beautiful. Thank you for sharing that,
Absolutely.
Bhooma. This is a big event. You know, it's only 4 hours in the program, but I'm guessing this takes a lot of time. Well, I'm not guessing. I'm quite certain it takes a long time to put together. What barriers have you identified that families run into with events like these, and how does CP Family Day try to remove them?
So I think that a lot of our families, when I see a family in clinic, often it's that family is walking a path by themselves, trying to get to the end of the day, and then repeat for the next day. I think CP Family Day breaks that down to show you how many other families like your family are here in this community, and what the other resources are in this community to help you, so that you're not walking alone. We're all walking together. I think it's also really nice for the clinic team. We're all there with our families, which is really nice, and members from the lab come and volunteer as well. So it really breaks down those walls also, that we're all in it together, walking on this journey together, and that you're not by yourself.
Hello. Yeah. Anything you'd like to add, Emma?
I guess kind of having like a multidisciplinary hospital system like we do that has an event like this. Just like knowing that this is an option. This event is intended for, it's kind of expanded. Initially, it was just intended for our clinic families. But then in recent years, it's been really intended for the whole greater community, greater St. Louis region altogether. So that can be a barrier to people even knowing about the event. You know, we do our best to like push for like promos for the event, like let people know that it's happening, but still it can be hard for people to even know. I just recently got a piece of feedback that someone learned about the event from Reddit, which was interesting.
Okay. Good to know.
But yeah, just in terms of knowing about the event, that it's a thing, and also, you know, kind of physically getting to the event. Previous years has been in the morning, at like 8 or 9 a.m. I think, start time. So that's got a lot for our families to get ready in the morning for a full day out in the garden. That can be a lot.
So this year we shifted it to the evening,
Yeah,
right?
this year, yes. This year we did shift it to the evening, and heard many people say that they appreciated that. It was easier for them to get to it.
Yeah, things like these that don't seem like a big deal, but timing,
Yeah.
Mm-hmm.
The location, obviously.
Yeah.
I think the other thing that's unique about our event, or that I think is unique about our event, is from the very beginning, we wanted to give caregivers an opportunity to connect with each other without also have to simultaneously focus on caring for their child or their children. So the fact that Emma, as the event organizer, carefully puts together parallel programming for the kids to be taken through the Missouri Botanical Gardens, which is renowned for being a very accessible space and really prioritizes that. So kids and their siblings, and we're very explicit that it's not just the person with CP or the child with CP is invited, but the whole family, all the kids are invited. So everybody is out in the gardens together. My kids have attended and are out in the gardens with the other kids too. And then the caregivers get to spend adult time together
Yeah.
without having to also think about, does someone know where my kids' seizure rescue medications are? Because it's our clinic teams that are helping take our kids through the gardens.
Right.
So it is an opportunity for the kids to connect with each other and build community amongst the children. And also for the caregivers, which is so rare. Like, it's rare that I can get a babysitter to care for my kids so I can go on date night with my husband. So it's nice for the caregivers to have time to connect with each other separate from the kids too.
That's actually, that goes into the next question I was going to ask. So you got a little ahead of
Uh-oh.
it all. But before I go into the next one, I'm going to say just how beautiful it was for me to just walk in there and to see so many families, so many children with their siblings. Man, it makes me wish I had that growing up. It makes the world of a difference. Thank you so much.
Thank you for being a part of ours. We're so happy you were here.
Thank you, because it really makes a difference to be able to see yourself in others and to create that community. And going to the next question, which you might say, like, I already answered that, but that's okay. I'm still gonna ask it. And you've built this entire day around 2 tracks, right? And one for caregivers and one for the kids. What was the thinking behind that? So I think you responded to that, but if you want to add anything more.
Anything to that?
I don't think I have much more to add. Just space for caregivers to kind of focus on connecting with each other and gaining access to resources, so that they can have their kind of full attention on that. I mean, and also obviously for the kids to connect, to know that they're not alone, that there's other people out there like them, and also that they can connect with their siblings who may not have CP,
Right.
to know that they're part of a bigger community.
Absolutely.
Yeah.
I mean, I went outside with the kids. I was inside I was all over the place.
Yeah.
I was taking pictures all over the
Good.
place. But I went to the sensory garden, which was amazing. You had a session, or I don't know if it's a session, I don't know how to call it.
Yeah.
The therapeutic
Yes,
horticulture.
therapeutic horticulture.
Yes,
Yeah.
that one. That's very hard for me to pronounce.
That's hard,
Yeah, it's
And I
amazing.
did that, and it was amazing. I can't remember her name right now, but Jeannie is her name. I introduced myself. She was telling me about the plants and the flowers and all that. And there was this part where I saw kids dancing, and they were so happy and playing instruments, and I'm like, oh my God, I just
Different
want to.
dynamics.
It's a big hit.
I want to join them. And then, I went in and saw my fellow peers there talking further about what it is to grow up with CP. But going back to something I mentioned earlier is that this year I had the honor of moderating the panel with other adults. And thank you so much, Emma. Thank you so much, Bhooma, for inviting me to be part of this. Like I said, I feel completely honored to be among them. And for me, it was a very cathartic experience, because they were very vulnerable questions, and we were talking about very vulnerable topics that we usually don't have the space to talk about. We talked about relationships, about dating, about sex, about independence. Nowhere else have I had the opportunity to talk about this, and I'm very grateful for that. What do you hope that caregivers take away from a panel of adults talking about their experiences growing up with CP?
I think first and foremost, I want caregivers to dream about their kids getting married or their kids dating, or to conceptualize that it is possible for their child with CP to grow up and have those experiences that many parents have the privilege of taking for granted, right? So that first and foremost, we wanted to make sure that caregivers could experience. The other aspect of this is I think that it's important to make clear that a part of what you should demand of your care as a person with CP or as a caregiver is to receive care that's centered around making sure that you can have healthy relationships, which includes the ability to have healthy sexual relationships, and that should be a conversation that we're all comfortable having. So starting to have these conversations, it's important both so you can envision that future, and also so you can be comfortable having those conversations with your physician when you're talking about, these are things that I want to be able to do. Can you help me do them? Given that I have CP and it affects my body in this way.
Yeah.
So those, from a clinician standpoint, that's why, and as a mom, that's why it was important to me.
Well, I can tell you that, as I said, for me it was a very cathartic experience. I was, for the first time in my life, I can really say that it was truly an open book. Because there are topics and certain things I do not talk about in my life unless I feel in a safe environment or with friends that I'm like, okay, this is my friend and I'm comfortable. But I had never before been so open about my experiences in the dating and my fears and my insecurities that I shared with a whole group of people. And it was over 100 people, it seemed. Mm-hmm. So it was a big room and I was like, oh my goodness. But then I thought, if there's a place for you to share, it's this one, right? Mm-hmm. I felt like parents, disability is a profoundly personal experience. So my experience is only my experience. But I think it was such a varied panel, and we all provided such different perspectives that there was a wealth of knowledge there, and we got really, really good questions afterwards. So I think that was in response to the panel itself. So thank you for putting it together. It really means the world to me that you did it.
Thank you for being so vulnerable. That takes a lot of strength and bravery. We really appreciate you doing that.
Thank you, my friend. Thank you.
I wanted to add a point to that your strength and vulnerability, and all the panelists' strength and vulnerability and sharing these deeply personal stories inspires families to do the same thing. And that's what we want. And that is what you did.
Thank you. Thank you, my dear. And I want to thank Kelly and Ryan and Diane and Terry, who I'm sure will be listening to this episode. Thank you for sharing your strength, your courage, and your vulnerability as well. You were beautiful people, and I'm glad that this event brought us together. Oh my God, no Kleenex yet. I'm good. I'm good. One of the things that I saw, and this is for the caregiver track, is your resources. And there was financial assistance, support groups, mental health, housing, employment, and even post-secondary education. So it was a wide range of resources. How do you decide who to bring in?
How do we decide? Well, the event organizer before me, who really launched this from the ground up, Kelsey Steffen, shout out. I think one of her mentors, Casey Wisdom at St. Louis the special school district. The special school district of St. Louis was connected. Kelsey was connected to her, and Casey was really kind of foundational in reaching out to these other organizations in the area, such as Sunny Hill, and Homes Will Succeed, and at one point June Jesse. So it's really connecting with one resource. They're kind of all connected, so it was kind of easy in that way. And we wanted to cover various domains in life. we're really cognizant that every family attending is in different parts of life, have different needs. So yeah, it was really important that we had various resource sessions out there, so that if one thing doesn't pertain to you, that's okay. You can go attend something else. Yeah.
And again, these are topics that you hardly ever, encounter. Housing, employment, post-secondary education. So thank you for having those. And I think this one is particularly for you, Bhooma. A lot of resources are about long-term goals, right? And how do you help caregivers in your clinic shift towards longer view of their child's future?
Yeah. So this is actually this is something that Emma and I can both talk about, because Emma's been instrumental for helping us do this in the clinic as well.
Okay.
I think thinking about long-term really begins, right when you're starting to meet a family. I know that I talk about something like hip surveillance, for example, as the reason we're doing hip surveillance is to think about preventing hip arthritis when you're in your teens, so that you can maintain mobility into adulthood. And we start hip screening when you're very young, less than 2 sometimes, a little bit older. So with the first hip x-ray, I say, I'm planning now for your child to grow up. So from a very young age, we're talking to families about that we're in it for the long haul. And if, people can be at different stages about when they're ready to think about that, but it's important for me to know that we are thinking about that from a medical perspective very early on. Together with many people in the lab, and Emma's been really instrumental for this. Susie Kim is our lab's informatics expert, and she's helped put together a standardized questionnaire for our clinic that goes through transition-related issues. So have you thought about guardianship and medical decision-making? What have you thought about financial planning? What have you thought about what you're going to do when school's over? When you're 21 is when you can no longer attend public schools. So what are you going to do after that? Is it a day program? Is it college in a traditional curriculum? Is it college in a curriculum like Still Succeed that's designed for people with disabilities? What's the plan? And then we also ask families to outline the types of care they think they will need to help their child live a long, full, and happy life. And that's how we phrase it. It's not, do you need seizure care? No, we're thinking about the types of medical care you'll need to live a full life. That questionnaire automatically our families start filling out. It was at 16, now it'll be at 14. And then in our clinic, we have a social worker for all of those families come in and discuss the family's responses. And then we ask them that every visit to see how that evolves. And our social worker is available at every visit to talk through those things. And she will definitely see our families at least once a year, starting at now age 14, previously age 16, to talk through that. And then the other aspect of this that I'll have Emma talk about is we've talked about these in-person resources that were, or resource sessions at CP Family Day. Emma's built out a really beautiful online resource to think through this too, if you want to talk about that.
Yeah. Yeah. So, in thinking through these transition needs, all these discussions, something that kind of came up is that like all of these resources are really scattered. There's not really,
Central
location for them, and it's our families already have a lot to navigate, like having to navigate all these different like websites, and like it can be a lot. So that kind of inspired this idea to just why not just have it all in one spot online. So yeah, that's really kind of in tandem with CP Family Day transition related stuff. That's what I've been working on. And it's, it went live a few weeks ago. Yeah. cptransition.com.
Yay! Okay, say it again.
cptransition.com.
Yay!
Yeah.
Brought to you by Emma.
Brought to you by me.
That's right.
It kind of includes a lot. I mean, everything you can think of related to transition, medical decision making and guardianship, health insurance. There's a little section on relationships, housing, education, all these things. There's a lot of resources for each of those kind of domains, and there's already some organizations out there that have like transition toolkits. So those are linked in there as well. It's got a lot. And that was in one of the folders for CP Family Day. So definitely hoping that a lot of the providers, resource community providers who are at CP Family Day, they're in that website, really just hoping that it helps streamline some stuff for our families, makes it less, takes one less thing off their plate.
Yeah, I think as people living in CP and also caregivers, that there's well, at least in my case, back in the day when I was growing up, there was like the neurologist, the physical therapist, the orthopedic surgeon. It was all different.
Yeah.
They were all in different schedules, right? And so it was appointments for each of them independently, and it was so hard to navigate and understand all of that. And then you add the language barrier, but thank you for doing that for families. Say the website again.
cptransition.com.
Yay!
Ooh, we should do a jingle. Maybe I'm gonna do a jingle for the website. Yeah, you know what? Give me some time, and I'll be creative, and I'll create like a little jingle with some music and stuff.
Lovely, a woman of so many talents.
Yeah, I'll come up with something. A video. I'll come up with something.
Is it okay if I talk about our clinical care program for adults with CP?
Yeah,
Do we have time?
absolutely. Yes,
Okay.
we do.
So this is something that we're actively building and optimizing, but we're starting to transition people with CP through this program beginning this year, where after we help plan for transition planning and talk through resources through cptransition.com and think through these questions with our families and our social worker, our families go when there's an adult CP clinic at Barnes that provides care through physical medicine rehabilitation, where PT, OT, seating and equipment specialists are all present in the same clinic. And there's a social worker that they're connected to on that side as well. We're also simultaneously starting to refer families to neurology and build that process where complex tone management and also surveilling for many of the neurologic conditions that show up in adulthood that may not have existed in childhood.
Such as.
So there's data to show that adults with CP are at increased risk of stroke compared to adults without CP. There's emerging data to show that they're at increased risk of some dementias compared to adults without CP, and then myelopathy, so spinal cord compression that can cause loss of function. And then on top of that, adults with CP have tone issues that change. So your tone doesn't stay the same throughout your whole life. It can change and evolve, particularly in adulthood with CP. So for all of these reasons, our adult neurologists or movement disorder specialists are also seeing our adults with CP to help surveil for these things. And we're also talking to our neuropsychology department on the adult side, are also going to be seeing adults as they transition with CP to make sure that we're catching on any sort of cognitive changes early to see if we can intervene. Something else that can show up in adulthood with CP is new onset epilepsy. And sometimes that can be really subtle. So these are all things that we're hoping that we can do to be able to keep adults with CP healthy. And not just be reactive, but proactive. And we're really proud of this. We don't think, to our knowledge, there isn't another sort of proactive surveillance like system, medical system, or care pathway, to our knowledge, in the country like this. So we're really proud to be able to launch this.
And so it's fully launched already. It's
Well, we're starting we're starting to refer our first patients through that pathway this year.
wow.
Yeah,
okay.
so yeah, this is the year. We're starting this year.
2026.
2026.
And you heard it in Parálisis Cerebral Respuesta. So if you're an adult with CP, come to see Bhooma in St. Louis, please.
Oh no, the floodgates have opened. Yes. Yes.
Sorry, friend.
No, that's good. That's good. Yeah.
That's amazing. Thank you for doing that, because I think a lot of what is being done is always in response to, is reacting to something, but hardly ever really. I mean, the fact that you're the first one in the nation is or to all of our knowledges, doing all of this and screening adults with CP for these issues, that is amazing. Thank you so much. So you're leading the way.
Yeah, we are as a team, right?
Yes.
It's a big effort.
And how, I mean, and this is totally not part of the questions I had, but like, how do you navigate that? Because you don't have any data to guide you through this process. So how are you doing this?
Yeah, great question, Asustina. So there is some general epidemiologic data. So we have data showing that the rates of increased risk for these different conditions. But in terms of how to conduct clinical practice, I think for one, you have to start somewhere.
Okay.
So we think about, what's feasible and what makes clinical sense. For a lot of people with CP, that I'm sure sounds very familiar, right? Like we are often operating in a data-free zone for a lot of what we do, and that's why shared medical decision making together with the family and the person with CP is so important. So we've built this. This isn't something that I built or Emma built or that just doctors built or just clinicians built. It was built in partnership with a lot of our families in the CP Center, including with advice from, some of the people on the panel that you met. So this has been like a collective goal. I'll also say that it's important for us, our hope, and this is also something that Emma is doing. Emma's a very modest person. This is also something that Emma's doing, is we're also asking families to be a part of a research process where we're trying to see if we can identify biomarkers that will help us be able to tell earlier if there's any sort of risk of decline, with the goal of being able to identify targets for preventative treatments. So the short answer is you have to start somewhere, just because I can't wait for someone to write a blueprint for us to start doing the right thing. So we're going to do the right thing and we're going to build the blueprint.
Of course.
Yeah.
Yeah.
Classic. Classic us. Yeah, that's what we do.
Amazing. I'm sure in the process there's a lot of fears and uncertainties and things like, oh my God. So you are being, it's a whole collective effort. It's parents, it's individuals,
Yes.
It's the team. Okay.
Yeah. Nothing like this can never be done alone. Just like CP Family Day.
Yes.
Just like a family caring for a child with CP can't be done alone.
It's a collective effort.
That's right.
Thank you so much for that, and I'll follow up. I think I have already like a couple ideas for future episodes.
Yeah.
So I think you'll be hearing Emma and Bhooma in other episodes. Just so you know, I'm just telling them. They're just finding this out. And going back to CP Family Day, and we're towards the end, unfortunately, now of our interview, but it's in the Botanical Gardens, which, by the way, is one of my favorite places in the U.S. I love the Botanical Gardens and the Butterfly House. I love butterflies. So St. Louis.
Come to St. Louis, y'all.
Yes! The city of St. Louis.
Yeah, we're the best.
It's just so beautiful. I love butterflies. I love the Botanical Garden because it's divided by sections. The Victorian Garden is,
Yeah.
So in the garden, and all these events that you had going on, activities I should say, you had medically trained staff lead the activities. So what does it mean to have physicians, therapists, nurses alongside the kids other than in a clinical setting?
Other than clinical, I mean, I'd say, well, one kind of practically and for kind of ease of mind for our families or parents to know that like it is safe to let your to, be separate from your kid, that like they're in safe hands. But also, I mean, for me personally, like I know that they're all medical personnel, but like when we're there, all the volunteers have a CP Family Day t-shirt on, just like casual clothing, and it's kind of hard to tell that they're like from the hospital, that they're medical personnel. They're just kind of people that care, about the kids and want them to have fun.
Yeah, I think that's really, it's valuable to not, I think it like builds that concept of community, like we're all in this together. I think for me, the first time that one of my children came to CP Family Day, I think this is really what's most telling for me. I thought I had to, I may have told this to you before, Azucena, but I thought I had to prep him for this. Like you're going to see kids in wheelchairs. You're going to see kids with walkers. He's like, yeah, Mom, I know, I got it. Like he was totally, it was just a matter of fact of life.
Yeah.
And it was so beautiful to me. I don't think I don't think he picked up on how like powerful that sort of nonchalance is. I wish I had grown up that way, to be around, to have everybody in the same place doing the same thing, because accessibility and inclusion is prioritized. And it makes me really proud that my children are growing up in a world where CP Family Day exists, and they can see that and just think it's how it's always been. That's the goal, right? The goal is to make accessibility and inclusion something that's so normalized that it's not something that is unusual, it's something that's expected.
Right.
So I think that is the real value in having us all there on equal footing.
That's amazing. Yeah, I saw so many kids with their siblings and their families, just the diversity of the event itself. I had I didn't know this. I had a doctor come to me and she's like, "Thank you for sharing about your experience with your mom," for example, because we come from a Mexican background. And she said, usually when I deal with, when I have families from Hispanic, Latino communities, the interaction is very different. What do you recommend that I do? What should I keep in mind? They don't really question anything and I said, I can tell you from my experience, my mom was not taught to question a doctor by no means. So in her eyes, the doctors are on top of the food chain and you do not. So my care was very different, right? So I gave her from my perspective, and so it was very, very interesting to just see them all. And I thought they were parents, but no, it was physicians, and so thank you for that, because everyone was wearing the same shirt, and everyone was the same.
Yeah.
And the fact that the garden itself is so accessible, that in itself makes a point that accessibility and inclusion matters. So, final two questions. Across the years that you've done this, is there a moment that stayed with you and that captures why CP Family Day matters? This is this year was the fourth.
This is the fourth year.
Yeah. So it's okay. We're gonna give them time to think.
I think that for me, there was the father of one of my kids, one of the kids that I see in clinic rather, had said, and this guy is like, he's like a big guy, he's like a big mustache, like he's man's man kind of guy. He was in one of our in one of our interviews, he started tearing up and said, this is like, we moved here for this. It moved to St. Louis for this and for community building events like this, and that it was beautiful to feel like not so alone. And interestingly, our very first family day, there was another like big masculine guy, another dad of one of our kids, one of the kids that we see, who said that it was really beautiful to him that this was the first time he had been in the same space as so many other parents or caregivers like him, that he'd never had that experience before. And then he was tearing up. And then we all started crying. We all needed Kleenex. Why haven't we had Kleenex yet? I feel like, so that was really powerful. I think like the concept of, how horrible to feel alone. So, and particularly for these individuals who, I would stereotype as people that are like very, hard and are not going to show emotion, to get so emotional about not feeling alone anymore. I think that's what CP Family Day is about.
Well, it was for me. Yeah. I think for the first time ever, I really felt in community, in a place I truly feel seen for everything that I am. So, man, Rady Children's, you're going to listen to this episode.
Well, what are they going to do?
No, well, I just hope, one of the reasons why I'm doing this episode is because I want to have more adult clinics. I mean, do CP Family Day and just be inspired.
Yes.
Because you're not only leading in all these other things, but just putting CP Family Day together is amazing. I know down in San Diego, we don't have that.
Yeah.
So it means the world to be seen, because I think essentially that's all what we want, right? To be able to contribute and to be seen for who we are, the full breadth of ourselves. And I think that this event captures that and manages to do that. So thank you for that. Do you need Kleenex?
Maybe.
It's right in front.
It's right there.
And for those, well, obviously you can't see this because this is only audio. Bhooma, as you all know, my favorite color is yellow. Bhooma's color, I can only assume her favorite color is purple.
Purple themed office, y'all. Yeah.
She loves purple. So, then there's a card that says, "My mom is the best." That is so adorable. Thank you, children, for doing that for mommy.
Yeah.
She is the best. The final question. So, for a family hearing about this event in this podcast, how can they get involved, or how can they attend next year?
Yeah, if you Google, this is the website is a little bit long. It's but it should be the first hit for CP Family Day. It's neurology.worcester.edu/items/cerebral palsy family day. Okay. But if you Google CP Family Day, there's a link, there's a countdown to next year's event.
Okay.
And then when registration opens, there's a link to register.
Yeah.
Okay.
Yeah. Typically registration opens 1 month before the event.
Okay.
You know what we should do? We should put a link on cptransition.com to the CP Family Day website.
Yeah, we could do that.
We're finding ways live.
Live. We're not actually live, right? We're not live right now, are we?
No, we're not.
Okay. Can we just say that and put a link on that website that links back to here?
Yeah, we could. I'm trying to think.
Is there any harm in doing that? Because Rashab controls the website, right?
Yeah, no harm. Just find a spot for him to put it.
Yeah, we'll just say that. That's going to be our official answer. That is the official answer. Okay.
What is the official answer?
Okay.
For families hearing this for the first time and who want to be involved in this next year, how can they get involved?
So probably the easiest way for families that aren't already being cared for at St. Louis Children's Hospital or as a part of our adult transition program is to find us on the web. The neurology department at WashU, so neurology.worcester.edu, links to CP Family Day. But the easiest way to get to that website is from cptransition.com. We'll have a link there that links to the CP Family Day website. And once registration opens, you can register there.
Okay, and I'll also add the link to the registration of the website in the show notes.
Yeah. And also if you're maybe a resource provider of some kind, or you want to contribute in that way, you can email me at cpfamilyday@worcester.edu.
Okay. And I'll also have that email on the show notes so that they can email you, Emma Lott.
Yes.
Emma Lott, best event organizer.
Yay!
Yeah, Emma.
Bravo. That's it, friends.
Yay.
We are done. We thank you so much for putting this
Thank
together.
you.
Thank you.
It was a wonderful event, and if anything, I wish it would have lasted more.
Yeah.
That's the top complaint.
Really?
Everyone
Yeah.
wants it to be longer.
Everyone wants it to be longer.
Oh,
Yeah.
wow. Okay.
Yeah.
But I know that in order for these events to happen, there needs to be funding. So that's also
Yeah.
an issue that,
Yeah.
you encounter. So hopefully it can be longer. But if not, what you did and what you have done so far has changed so many lives, I'm sure. I mean, I had so many parents come to me afterwards, and there were so many great questions. There was like there was a question from a family that said, how I'm a parent of twins. One of them has CP and the other one doesn't. How do I, and they're 4 years old. How do I tell, what do you recommend? And this is to the adults. How do you recommend that I start telling my 4-year-old who has CP that she has CP and how and what CP is and why she has it as opposed to her sister? And then there was another one that said, this one was very personal because I shared something that for a very long time, because I've had so many surgeries, I felt like my life passed me by and that I really didn't have a childhood. And then a parent said, I'm a mom that is determined to take my kid to every therapy session. Do you regret having so much therapy? Because I heard you say that you felt like your life passed you by. That was such a deep question, and I responded yes.
Yeah.
But at the same time, I will add, disability is a very profoundly personal experience. So it just depends. I mean, yeah, there were so many questions, very good questions from the caregivers that I was like, yes, this is what we need, right? What other space can they ask these questions so openly?
Yeah.
And that's why there's such huge value in events like these. So I'm your number one fan. I'm here to support you in any way that I can.
You want to come back next year?
Yes, of
Really?
course.
Yay!
Yeah.
Okay.
Yes, I already told Emma.
Fantastic.
And, yeah, thank you so much for having this event. Like I said, it means the world.
Yeah.
I applaud you. I deeply honored to be in the same room with you. Thank you so much, friends, for doing all the work that you do. You inspire me to be better. And thank you for helping my life be better, and not only mine, but the life of so many other people, children, parents with CP. And it all begins with events like these. So thank you. With that, we wrap up the episode. Thank you for listening to Parálisis Cerebral Respuestas. It's been an honor.
Esto es todo por hoy. Gracias por acompañarme en otro episodio más de Parálisis Cerebral Respuestas. Si tienes alguna pregunta sobre la parálisis cerebral en español o inglés, por favor envíala a mi sitio web www.azucenagarcia.com. Gracias.